Welcome, welcome all. Welcome. Good morning. Good morning. Welcome to Humanity Unplugged podcast. I'm your host, Jermaine McCrimmon. We'd like to thank you guys for tuning in with us today, August 26th, Tuesday, 2025. And this is a great episode. We're going to talk about some safety. And I want you guys to lock in, get your coffee, and hopefully, when this episode is finished, you guys will have a better perspective on making sure you are conscious of your surroundings. Um, we like to thank everyone. First off, we got to thank the man up high who looks low and give us the wisdom and knowledge to go forward and support and give out the love, care, and the understanding to our loved ones to continue to push forward every day of the week. And we know that, anything can happen. It's back to school time. Some of you are frustrated with the traffic because the school buses that live in the suburban areas. Some of the ones that's in the bigger cities, you just see a lot more congestion on the trains and buses. And this is what we have to continue to deal with while our young ones get the knowledge to move forward. And as we look into that and we look into young ones and people that are on the move every day, and we might not think about it as often as we should, we need to uh, do a reflection in month eight in August. Let's reflect. Let's reflect into what went on all around the world, but specifically, I can't say the word right. My people always tell me that. Um, specifically, I think that's it. That we need to look into the safety and the safety, especially in the hospitals. Back in March, I did an episode about York, Pennsylvania hospital and how a gunman, active shooter, came in there. He took three people lives. He shot three people, killed them, and he just walked right in with a gun. Um, that's not a good thing. Then I spoke about overseas, I think in Cameron or out in Pakistan, I believe it was. I spoke about how the mob just walked into the hospital and they literally pulled guns from their waistlines and executed a patient who was a prisoner who was getting a procedure done, but I guess he was going to rat on the cartel and they took him out. And excuse me, in Oklahoma, we had an Ingrid hospital. We had a shooting a couple days ago, maybe 3 to 4 days. There was a shooting out there near the hospital or domestic violence that led into the hospital. The aggressor was shot and killed. Dietrich Loss, I believe his name is. He was killed, executed. Well, I can't say executed, but he was taken down by police. But a 72-year-old security officer was killed in the process, along with the victim of domestic violence. In Allenton Moore Hospital on the 11th, Tacoma, Washington, Seattle, Washington, Tacoma Hospital, Allen Moore Hospital to be exact. Uh, People were shot and killed there on the 11th of August. In Detroit, 823, Henry Ford Health, Mario Green decided to kill his loved one. And what I want us to get into the practice of how safe is the hospitals that you go into to get treatment? How safe is the schools your kids go to every day? Because we are seeing something that's happening over and over and over where people are having access to bring weapons in to an area that should be for people that needs help, not to wonder if you're going to get shot while you're sitting there in a hospital. So there need to be better precautions, better emergency planning, better security before you reach into where nurses, visitors, and patients are. And that's what the common denominator that we're seeing with all these incidents. I just named to you four different incidents. We had Detroit, York, Pennsylvania, Oklahoma Injured Hospital, and Allen Moore Hospital in Seattle, Washington. And this happening all the time. 3 years ago, we can go back where a hospital, people got shot, St. Francis Hospital in Tulsa, Oklahoma. It's happening all the time. It's steady happening. And what's so sad is we're not seeing nothing done by administration. Now, I do see improvements at certain hospitals. There is a resistance at certain hospitals. I would say that down here in the South, guards, protection services, or security services, they are carrying guns. They have their bulletproof vests. They are ready to act. And I know I know what it looks like to people that coming in just to get medical attention. Is this necessary? Is it necessary for you to have to almost strip and take out all your clothes and all your medals to get seen by a doctor? Is it necessary for us to have food pantries? Is it necessary for churches to ask for donations? Is it necessary that Trump closed down the programs that he closing down? Is it necessary for food to be so high? Is it necessary that you need to put some money up and save money a little bit for emergencies? The answer is yes. The answer is yes, it's necessary for us to take these precautions to try to ensure the safety. So we got to put plexiglass up, bulletproof glass up, metal detectors, strip, breathalyzer before you come in there. There should be no cost or no turn or no, as they say, twigs pulled, not pulled to ensure the safety for your employees and for the people that's coming in that need medical attention. You shouldn't ever go to a hospital and got to wonder if you're going to make it out of there alive because of people coming in there with guns. So if we have hospitals in United States that's that rough, that we need a presence like that, and I heard we got them. Why is it not being addressed by the state, by the federal government? Are they simply allowing this to happen? I mean, in Pennsylvania, York, Pennsylvania, I understand you can carry and all this other stuff, but why there's no metal detectors or no precautions set forth prior to you entering into the hospital? So before you get to the registration, security, police right there, go through the metal detector, take everything out your pockets. Guns, pepper sprays, knives, butter knife, anything that looked like a knife. Anything that looked like liquid that can turn into, could be kerosene, could be gasoline. It can't be brought in. Why is that not being established? It's 2025. We can create babies coming out of robots, out of the fetus of a robot, but we can't ensure the safety of people in hospitals. We could be all over the world, traveling all through the moon and doing all the other stuff, but we cannot get it together to have a safe platform for people to come in to get that need medical attention. Why we can't do that? Why can't we not get a hold of it? How difficult is it to cut a budget, special training, implement it, and make it happen in the hospitals? How hard is that? But we pay doctors, nurses, big money, but we don't care about the safety of the patients. We got $1 billion x-ray machines, $1 billion MRI machines, heart transplants being done all over the world. People are figuring out how to see for the first time. Transplants, everything, prosthetic limbs, everything's going on. And we can't get an x-ray machine. We can't get the proper screening put together before you enter. I'm just asking. What is the problem? What's the holdup? Is it one, the laws by the federal and state, where you at? Two, is it the electees, the CEOs, the people who run the hospital, business administration, health and hospital corporation? Is it the people that's sitting in those seats? Is it the communities that we live in? What is the problem? Where do we bump heads at? Because you do know the tougher the times, the more active it gets. Excuse me. Excuse me. We have to understand that we have to make a line in the sand and figure out what is needed, what need to be done, and execute. Where's the special training? Is anybody doing active shooter drills? Is anybody conducting drills in these hospitals, keeping the staff alert, aware of what's going on? Who's at the forefront? I went to a hospital the other day. It was after 7, rolled right up to the hospital, parked my vehicle, and no one stopped me. I went to the front desk, told the lady who I wanted to see. They said, sure. Gave me a pass, and I walked. Security wasn't even there. No metal detectors, nothing. Why are we so lenient? I walked through the hospital. I could have shot 4 or 5 people before anyone came around me. Why? It wasn't late at night. It had just got dark. Maybe it's 8 o'clock. No security at the desk, no law enforcement at the desk, no nothing. Big hospital too, major hospital. Major hospital. Top 3 hospitals in my state where I work at. And I was able to walk in, regular street clothes, went to the desk, told them what I wanted to see. No security was there, didn't have to show my ID, nothing. Nothing at all. I just named a person. They were there. I went. Helped me get directions to get there. I asked people and gave me directions how to get into where the person was. It's that easy. It's too easy. We are too relaxed. America is too nonchalant, spoiled, and too relaxed is why things happen to us. And hopefully this podcast can make you more aware of your surroundings. This episode can bring some awareness to you. In Detroit, Mario Green His wife or ex-wife, girlfriend, whatever you want to call her, was working in the basement. He walked in with a bag, went to the basement, shot her. I don't know if they had a shootout, but allegedly, what is being said, he got away. They had a manhunt for him. How is this possible? Where law enforcement at? Where's security at? But he got caught later, but she gone, dead. York, Pennsylvania. Man went to intensive care unit, shot 3 people up there. That means he came in, past the front desk, took an elevator up, and then off 3 people. Where law enforcement at? Where the security procedures and who's implementing any type of structure there? How's that happening? 3 people shot and killed. Ingrid Hospital, Oklahoma. Somebody had domestic violence allegedly outside near the hospital, end up being in the hospital. I don't know. Allen Moore Hospital, Seattle, Washington. People came into the ED and shot 2 or 3 people. Emergency room. They went in there and just shot 3 or 4 people. 2 to 3 people, I believe, were shot. How? So what you're noticing, as I repeat this over and over and over, there's no measure, simple measure, before you're able to get registered, before you're able to see anyone. There should be a procedure done right there. When you walk in that door, oh, how can we help you? Oh, I'm here to see a doctor. Okay, you got to go through this metal detector. Take everything out your pockets. Da 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 da. Ba 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 ba. Right there, before you're able to get to the register, the registration. That procedure doesn't happen here. Even if you're here to visit, make them go through that metal detector. If they got to get wanded, so be it. Take your belt off, whatever it is. Let's go. Lift the shirt. We got to make sure there's no gun there. Got to pat them down. Zero tolerance. Why that's not happening? Why it's not being pushed like that? I don't understand. That one measure that costs you some money could ensure the safety from 5 to 8%. Easy. Number one, the word gets out. They're not playing in there. Number two, don't try it in there. You might get shot yourself. They might put you down. Number three, the biggest one is this. The person that want to do the harm might say, there's easier targets for me other than trying to get it done in this hospital. Let me find another hospital that's slacking. I hate to say that, but that's the truth. People go where there's less resistance. So it might be 6 hospitals in the area, but we ain't going there because them boys ain't playing. We're going to go to where there's not a scanner. We're going to go where there's not a metal detector. We're going to go, we can just walk in there and then we can lay some people out. Least resistance. That's where they're going. So these 4 hospitals I named to you has no protocols. They can say what they want, but what I just told you, stop it all. Trust me. You make them come in one door for emergency room and force them to go through one way to get in. You put the protection up, you put the barriers up, and you make them go through that scanner. You make them into their pockets. You make them do all that. They ain't got to like it, but that's what it is. Now, it doesn't take out all active shooters because an active shooter very well could work there. So a person could come with their ID and scan. Now, if I was in charge, I make even employees have to go through that. Now they can have their stuff in a clear bag. Excuse me. That way you can see the items, and that way they can put it on the side in this tray, walk through, woo, 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 keep it moving. It's that simple. You know what time you got to be to work, and if you know you might have a little line, get there earlier. It's that simple. I don't understand. But long as the Medicaid work or the Medicare work or the health insurance work, that's all we care about. We don't care about nothing else. Long as we can charge their coverage, we good. It's a fact, but it's an issue. Hospital safety is an issue, and we need to take a look at it again, revamp it, put some better structures, laws together, because when stuff hit the fan, and I'm saying it politely, when the S hit the fan, you need to have safe zones and safe places for the sick. And believe it or not, a hospital has everything you need in a crisis, a major crisis. A hospital has it. Generator, food, structure, and the capabilities of locking down. Do they even practice lockdown drills? Do they know what that is? It's just too lackadaisical. But what I'm saying, it's not extreme, but it just ain't normal for people in the South. They'd like to have the free buoyancy of coming and going and don't really think about that happening because we're not in the big major cities. So we don't really have to worry about that. Excuse me? It's happening. Your hospital, your state could be next. I'm just saying. So we need to look into that. For those who have questions or concerns, please email me at info@humanityunplugged.co.site. I'm here. We're not going nowhere. Episode after episode, we try to give you information that's useful for you. Please like, comment, and subscribe on all social media platforms. Now, that platform that has that is YouTube. We're on YouTube. We're on Instagram. We're on Facebook. Please, guys, check in with us. We're here. We're not going nowhere. I'm not going to go on anymore, but I just wanted to bring that to your attention. And also, before I close, I want to say this. In New Orleans, about 7 to 8 hours ago, maybe 12 by now in certain countries, wherever you at, a young lady, 17-year-old lady, got shot in the head, pregnant, by road rage driver. I'll say it again. 17-year-old pregnant woman got shot in the head from road rage on the road driving, her and an unknown male cutting each other off, acting a fool, got crazy. He got out and shot her in her head. They had to do a C-section and save the baby, and now she's sitting here fighting for her life. And I ask you guys who's outside in these streets, on these highways and byways, is it worth it? Is it worth it riding on somebody's ass, acting stupid on the highway? Is it worth it? Is it worth it to cut somebody off? Is it worth it? Are you in that much of a rush that you got to drive like that? Let them go. Let them go. Just pull over to the side. Let them go. And I know you don't want to do that. That's just too much of the right thing to do. Just imagine you here today and tomorrow you're in the hospital. You don't know what's going on because you got bullets in your brain because someone decided to take you out or try to take you out because of driving. You know how mad a person had to be to pull a gun out and shoot you in your head for road rage. Do you understand the disregard of human life a person had to go into to get to that level to take you out for driving when you could have just pulled over to the side and let them go? We have to control our ego. We got to control our pride, our temptation. We have to learn to let things slide. It's okay. Let them go. It's all right. You get on the next light. Let them go. You don't know what that person is going through, that they have that anger, that rage in them, that they can say your life ain't worth it today and try to take you out. Could you imagine having full function and mobility in your life to do and go as you please? And after that incident, you are paraplegic. Mentally, you are destroyed because of a bad judgment call of you not letting that person, him or her, just go. Let them go. Pull over. Let them go. Tell them sorry. The other day, two-way street, I'm driving. Two-way. Traffic is oncoming from front to the back of my head. I'm going from the front of my face out. In front of me, the car is making a sharp right turn to the church. Oncoming traffic that's coming towards me is making a left into the same parking lot to go to the church. It's early in the morning. Service ain't start. It's no rush. So while he was turning to go in from middle lane or from right lane, making a right, I went around him and let him have it. The oncoming traffic that's making a left into that same lane that's going from facing me down behind my head took his hand out and gave me his middle finger. This man going to church and gave me his middle finger. Why? Because he didn't want to wait. He wanted to cut in and be right behind him. If I went around the first one, why can't you just wait? What was so wrong with a second of waiting? We have no patience. We want to be the first in, first out. Like our time is so more important than somebody else's. It's sad. So anyway, as I leave you people, much love to everyone. Be careful. This is the last one I'm going to talk about. My son is young, my baby boy, my baby bull. He's a good kid and I love him a lot. And he does a lot of outside activities. And I'm scared to death. I'm just being honest. And just now in the Bronx, a couple days ago, they had a basketball game out in Baychester. Young girl shot in the head, 17-year-old, clinging for her life. 4 or 5 people were shot. For what reason? No one knows. A nice crowd out there, but the people that gave the event, sometime people don't do the right thing. I'm not blaming them, but anytime you have a crowd of people, you need to notify PD and let them know that you would like their presence. People are dead. This lady, young girl, 17-year-old, fighting for her life. We don't know how it started. Bullets don't have names on them. And now she might not even finish high school. She lived in Hartford, Connecticut, came down, and now she'll never be the same. Be careful, guys. Talk to your children. Tell them about these incidents that's going on in the world. Make them aware. I'm your host, Jermaine McCrimmon. Much love to you. Peace.